There we go. We've got that recording going. Folks are in. Robert, if you would like to start us off on slide 1, please. All right, welcome to our 2024 Q1 meeting. Go ahead to the next one. Just that reminder on the next one that the meeting is going to be recorded. Just watch your mute button, make sure you know where it is so you can mute, unmute yourself as needed. And video is always welcome, not necessary, but it's always great to see some other faces on here. You can go ahead to the next one. This is our brief agenda. We are going to do some quick welcome and introductions. We are going to have an equity presentation and activity led by my colleague Alex Cohn. Food for Health, one of our implementation partners, is on to give a presentation and have a little feedback discussion. Our big focus for today is going to be prioritizing strategies for 2024 action, and then we'll have more updates and wrapping up. So just another quick reminder, watch those mute buttons. It always unmutes you when you first join a meeting. It's very inconvenient, I have found, when I'm trying to blow my nose or sneezing or something. If you want to go ahead to the next one, Robert. I jinxed myself. I talked about it. Incredible timing. I have not had that happen on a meeting before. I have started coughing in many other inconvenient situations, but none quite as impressive as this one. All right, so we just want to give a quick recap of the MKE Elevate vision and mission, just to keep everyone on the same page here. So our big focus is ensuring that in Milwaukee, people are thriving in safe, healthy, and equitable neighborhoods. Free from oppression. We want to align strategies and build power, partnership, and access to resources amongst ourselves, build opportunities for collective advocacy, and particularly around those community identified priority areas. And that is what we're doing today, that very last part. Go ahead to the next one, Robert. These are just a couple of shared agreements that we have across all of the action teams. So we just want to remind each other to step up and step back, just kind of take that space as other folks are contributing. We're going to respect all the team members' time and their expertise. We're going to support everyone's learning process throughout this whole process. We want to elevate the expertise of lived experience. I know in maternal child health that is particularly applicable. We want to listen to understand and support rather than to reply. And our North Star, we always want to keep in mind, it is the health of all people and neighborhoods in Milwaukee. The main lens we want to keep across all of the MKE Elevate teams and groups is an anti-racist lens. And so what we mean when we are using that in the health department is to understand our personal privileges and biases. We want to identify opportunities to reduce racial disparities and health inequities across the priority areas. And we want to commit to lifelong learning and developing shared language around racial inequality and health equity. And so some of this we're actually going to touch on in the equity activity that Alex will guide us through. Since it is Black History Month, my co-chairs suggested the great idea of giving us a quote to just kind of think about and discuss. So we have here from Barack Obama, "Change will not come if we wait for some other person or some other time. We are the ones we've been waiting for. We are the change that we seek." And so for me, it was, this was suggested by Lakita Watts, who unfortunately is out sick today, and it really felt very poignant for maternal and child health. We've all really been trying to make changes for a while, so hopefully this can really galvanize us together. So go ahead to the next one, Robert. For our introductions and icebreakers, if you were at the last meeting, this might be familiar to you. we are going to do random breakout rooms of 4 to 5 people. It'll be maybe 5 minutes, I think, just looking at the time. And for those introductions, we'll do name, organization, and then this graphic on the right here is the window of tolerance. I know there's a lot of words there. The yellow box in the center is our comfort zone. That is being within our window of tolerance. We're comfortable, we're calm, we're regulating, we are very receptive to information and discussion. The pink area up at the top is maybe hyper aroused. Maybe we've got some anxiety, a lot of things on our plate. We might be stressed about some things. Maybe we've been really busy. And then that blue zone in the bottom is hypo aroused, under aroused. So maybe we're really tired today. We're drained from some other things. So it is in the window, maybe high end of the window or low end of the window, just so that we kind of know what we're all bringing to this meeting. So for me, I think I am at the top end of that pink. I'm still not fully recovered after coughing right when I tried to start this meeting a little bit. So I was thrown for quite a loop, and I'm still trying to get myself back on track. If there's time after that, feel free to chat about that Black History Month quote by Barack Obama. And I believe Amanda has put these topics in the chat. We can put the quote in the chat as well. And I'm just gonna do that real quick. So that way the chat should carry over with you all into the breakout rooms. We've got 37 participants. So if we do 4 to 5, I think that's 9 breakout rooms. All right, you are going to be randomly assigned, I believe. It'll be about 4 of you per room for 5 minutes, so 4:14. And Robert, I think you can stop sharing for this part. Jackie and Javier, do you see an invitation to any breakout rooms right now? We're just doing introductions to each other in breakout rooms. Are you having any trouble, Javier?
So sorry, I need to use this time to step out.
Okay. You started off real quiet, but I think I heard that you need to step away for a moment.
Yes.
Okay. Hi Cheryl, we are just in some breakout rooms so we can do some small group introductions. We were just doing introductions, organization, and then kind of a window of tolerance about how receptive we are, you know, if we're stressed, if we're good to go, if we're maybe a little tired or something like that. We've got 1 minute. I can send you to a breakout room if you would like, otherwise you can just wait here.
I could just wait here for now. Cause I was just finishing something else up.
Absolutely, it happens. So Carrie, I was just updating Cheryl. You guys both joined. We are just about to finish our breakout room introduction. So they'll be coming back in just about a minute.
Thank you.
Thanks for the update.
I keep muting myself so that you guys don't have to hear my typing. Everyone is just wrapping up a quick breakout room introduction. So I will be bringing everyone back in about 15 seconds here.
Okay. How you doing, Melissa?
I'm doing all right. How are you doing, Dr. Greer?
I'm doing pretty good. Just got on a little late. Think I'm gonna have to close these blinds because the sun is coming through.
That happens. I'll be bringing everyone back. So everyone's going to come back into this room
Okay.
just about now. Everyone should be back in the main room by now. We had a couple of late folks join, so our breakout room down the line, you might see a couple folks you didn't get introduced to. Robert, if you want to go to the next one. Wanted to give just a little space if, you know, one or two folks had, you know, something really insightful, something really interesting in their breakout room. You're welcome to pop off mute if you've got a quick thought that you wanted to share around your conversation. If you thought of something you want to put in the chat, you're welcome to do that. Otherwise, we can get going forward. All right, and so now we're going to go to our equity activity. Go ahead to the next one. So my colleague Alex Cohn is our public health strategist who is focused on health equity. And so she is going to lead us through an activity exploring our personal and our organizational power. So Robert, I think you can stop sharing and then Alex will take over.
So I gotta pull the presentation. So hi, everyone. Like Melissa said, my name is Alex. I'm a public health strategist. I will say coming into this space, I'm on that hypo level with the window of tolerance. So I'm trying to get my energy back up. I have my colleague in the back that you'll see move around. He only likes to annoy me when I'm with other people. So for this activity, if you have your phone nearby or also your computer, you are going to go to minty.com. And then once you are there, you're going to type in that code of 7577-1859. And we can also put that in the chat. But for this activity, we will be talking about assessing your power, A, as an individual, and B, as the organization that you're representing in this space. So even though we can't always see it, power operates everywhere at all times, even in this space we're currently in. Power is not fixed or fluid, so it's forever changing, but it depends on various factors and relative to whatever space or community that we're in. So the reason that we're doing this activity today is to get our action teams to consider how powerful you are as individuals and as the organizations that you're representing, working towards system change and making Milwaukee a healthier place. So every action team is going to go through this process. Our steering committee went through this process and our PI department went through this process. So I think it's really important to how we assess the power that we're in. So this activity is meant to ease us into conversation about power. It's not going to get us concrete solutions today, but it'll help us expand how we understand and perceive power. And then hopefully when we meet together for our Q2 meeting, we'll talk about solutions on power sharing and how do we kind of get rid of those power imbalances that we see in this group. So we're just going to move forward. So there's a couple of benefits for accessing power. But first, there's this really great quote by Martin Luther King Jr. that the power is the ability to achieve a purpose. Whether or not it's good depends on the purpose. So there's a couple of benefits that we have when assessing our power as individuals and as organizations. So it helps combat feelings of powerlessness by identifying what you have control over. It helps process the paradox of feeling powerless within the system hierarchy, while also having relative power within the community. It helps pull back the veil on power structures impacting the work in this space as an action team. It increases the awareness of responsibility of having power and improve accountability. And it helps identify ways to share your power with those who have been structurally blocked from power due to their personal identities and lived experiences. So along with that, how do you perceive, what do you perceive as the benefits of addressing power in this space? So in this space as the action team meetings. So in the Menti, you would be able to share, and if you aren't able to use the Menti, you are more than welcome to put it in the chat or unmute. I will say the Menti is fully anonymous, so I can't see who's posting or anything of that nature. We have create a safer space, interact, lifts all voices. It can distract from getting things done, transparency, so that we can dismantle unfair power imbalances. It breaks down power struggles, equity, open communication, empowers people, helping them realize their contribution to collectively leverage different types of power in the room. Right? Because this is a pretty big room. I think our Zoom count is 42 people. That's a lot of different variations of power and identities and how we show up collectively. It creates communities so that everyone can feel that their ideas matter. So thank you for sharing. So the next question I have for you guys is how powerful are you as an individual on a scale of 0 to 10? A lot of times people unmute at this point and be like, well, what do you mean by that? In what setting? It's whatever factors that you think of, right? So that initial thought of like, how powerful are you? Because again, it's fluid. So your power that you hold in this space is going to be different than the power that you hold in different spaces, whether that's a community space, at home, anywhere. So it's really however you perceive yourself in terms of powerfulness. So right off the bat, I'm seeing a lot of the scale lean towards the higher end. We actually have an individual at 10. We have one person at 2, a lot in that 8 mark, so still pretty high, but again, leaning on that higher end. I'm going to give about 15, 20 more seconds for those if they would like to participate and be able to define how powerful you are. All right, I see it is slowing down on responses. So we're going to move to the next slide. And this is where you get to talk about, like, how did you decide where to place yourself? What are the factors that went into why you scaled yourself a 8 or a 9 or a 2? So like what went into your answer of where you placed yourself? Influence, training, skills, organization, ability to make decisions, job title, privilege, confidence, my network, the responsibilities I hold, education, position, organizational worldviews. I embody structural advantage and possess tremendous potential power because of it. Experience collaboration, comfort with speaking up and being heard. How I felt people looked to me for guidance and help with decision, positions. Bringing this content to my organization is new, meaning I need to establish the need for this work. Knowledge and positions. So a lot of reasons of why we placed ourselves in the way we did, and a lot of it, you know, tying to your job title, the privileges that you hold, the positions. And then one person said, I believe as an individual, I'm committed to advancing health equity, but I know I'm a part of a larger system that is oppressive and requires collective efforts for change. So thank you for those who responded on this. So now we're going to do the flip side of, like, how powerful are you as an organization? So the organization that you work for, how powerful is that organization? Again, on the different factors you can think of, but it's really how you initially think of it. All right, right off the bat, we got some high numbers at 8, 9, 7, and 6. 1 at 10. So by the looks of it, currently we have some really powerful organizations who are in this space today. So I'm gonna give about 10 more seconds if you would like to participate. All right. So how did you decide where to place your organization? Wealth. That's a common one that we hear when we do this activity. Influence in the community. Influence. Government entity that influences policy. So I was hearing a lot of influencing, visibility, knowledge, experiences, the perception in the community, the position in the community and impact, the size, program and policy scopes, strength of dedicated individuals and partners, decision-making across sectors. I'm going to give about 10 more seconds for those who would like to add in a response. Wealth, expert, expectations. So how are we tying this back into the action team, right? We assessed kind of what power is in the space today, individually and as an organization. So that means that there's some power imbalances that are showing up when the power isn't equally, like, contributed on that scale, right? There was a lot of higher numbers. So how do you think power imbalances show up in this space specifically as an action team? Again, these are anonymous responses. And we really just want to be able to work together and co-create solutions to make sure that power imbalances are not showing up in this space. The absence of voices, not being aware of what others are working on. Who do you know already? Race, miss, underrepresented, silos, by who gets asked to participate on higher goal, org chart hierarchy, agendas that do not fit the true need. I do want to say we appreciate the honesty with this conversation, and I know that we're really excited to move forward when working together with everyone who's in this space at the next meeting on solutions to really help lessen these power imbalances and address them. We have wealth distribution, gatekeepers to access, race and promotions. We have lack of clear communication in the chat. Thank you, Barbara. So I'm gonna give about 20 more seconds. I know it's like sometimes you don't realize power imbalances are happening until after you leave the space. And so these mentees will be opened for another 14 days. And so if something happened in this meeting, you know, that you're like, hey, that's a clear power imbalance, you're more than welcome to add those onto the list. Lack of funding, distribution among all. All right, agency influence. So in interest of time, I'm going to move on to the final question of today, which is what are ways that we can share power and decision makings in this space? So kind of looking at what those power imbalances that were listed on the prior slide, what are ways that the facilitators, what are ways that each other can share power and decision making with our action team? So with the maternal and child health action team. This one does take some thinking, so I don't mind giving people enough time and room to respond. We have Tracy in the chat. Thank you, with lived experiences and guide work. Pooling resources and not competing. More accessible meeting times and spaces. Collaboration. Participatory decision making. While people are thinking about a response to this question, I will say again that this isn't just like a one-time conversation. We're done. We're not going to come back to it. This is a part of a larger framework that's going to take about a year or two to work through. It's from the MAP 2.0 Power Primer, and it's a way that we assess and dismantle power imbalances within a bigger group. So change takes time. It doesn't happen overnight, but we're really excited to start with this conversation, and we're excited to be held accountable on a facilitator end. So final comments is dedicated space to speak without interruption. Use of chat features and hand raise via Zoom, maybe a steering committee, specialized committees. Prioritize what we can do with limited time, what will make the most impact with the people in the group. This type of anonymous space to share, accountability among all, develop a way of voting on what gets decided with frequent communication, and leverage large organizational and network power to support smaller entities and uplift voices. So that is my time today. I just want to thank you all for your participation on this. We will summarize everything a part of this activity, and then those would get sent out as well. But if there's a time, I can have a question or two, but I advise anyone who is a part of a larger organization to take this tool back and assess the power in your own organizations as well.
You can also drop comments in the chat if you need a moment to think on them a bit. I definitely appreciate this feedback, in particular, you know, not being aware of what others are working on and who is missing from this space. I know that I can't possibly get everyone into this action team on my own, so that is where, you know, you guys, your connections are invaluable to, you know, if you know that a power player is missing here or someone working on this stuff is missing, send them my way, do that email introduction, whatever it might be, make sure they get in this room. So if there are no questions or thoughts, again, we're gonna keep this with us as we move forward throughout the entire rest of our 5-year cycle. Thank you, Robert. You can go on to the next one. Again, you can keep putting your thoughts in the chat, but we are gonna go onwards to our implementation partner presentation. And so our spotlight this month, go ahead forward, is gonna be food for health. Just a reminder for these little spotlights, we really want to be able to highlight the partners so we can hear about organizations that we might not know about, learn about projects, start finding ways to connect. I know after the last one, multiple folks emailed me and wanted information on MHD's home visiting programs. Our official implementation partners are prioritized, but we're also going to try to prioritize those who are looking for specific feedback, which is kind of today's. I've already got kind of a list of folks who are interested or, you know, on deck, as it were, for presentations. But if you are interested in presenting to this group, all you got to do is let me know. I will add you to that list. So I'm going to pass it to Raina Andrews with Food for Health for an incredible presentation. I already got a sneak peek and it's awesome. It's very exciting.
Thank you for that, Melissa. And thank you everyone for allowing me to be here to pick your brains. So what I'd like to present today is I see a lot of familiar faces in the room. So I'd like to share just a bit about Food for Health, which will be a recap for a lot of our friends in the room. But I'm really leaning on this group as subject matter experts around maternal health to provide some candid feedback in a really safe way. So I think the intro and the tee up that Alex did was really helpful. So hello, I am Raina Andrews and I'm the Executive Director of Advancement Engagement at Food for Health. Just a bit about me is that I've been in the food systems work for about 16 years, working in government affairs, working in food banking, and now working in the space of food as medicine. And so just a bit about our organization.
Recent Gallup
Can you hear that?
shows more Americans than ever are
Yes.
medical care.
Obesity rates are on the rise nationwide, leading to public health issues.
The majority of Wisconsin residents are worried about the cost of health care.
As Americans, we are spending trillions on healthcare, but people are getting sicker.
A new study conducted by the Public Policy Forum shows the issues are especially acute in Milwaukee. The study also
And our lower income populations are 9 times more likely to die of preventable disease.
Things like diabetes, hypertension, obesity. It's not just about food, it's about poor food choices.
Our food is what's killing us. But there's hope. We are Food for Health.
Doman was founded here in Milwaukee, Wisconsin in 1858. In 2018, Doman made the bold decision to truly change the paradigm, to really move away from treatment and coming forward as part of the solution. It's this team and the conversation that's truly happening with the belief system that we can make a difference and make a difference through the power of food.
So nutrition is a key part of health awareness. About 25% of people with diabetes are food insecure. When you're financially insecure, it really affects your ability to purchase food, but also to purchase healthy foods. what I see with Food for Health is groundbreaking work in trying to identify solutions to some of these issues. And I'm really excited about some of the programs that are likely to have huge impact in the Milwaukee community.
Food for Health, which is our charitable program, provides low-income individuals who are living with a diet-related disease access to medically tailored meals with a dedicated health coach to provide support with an additional customized app. So it's a comprehensive program that truly wraps around the individual that otherwise wouldn't be able to afford it on their own. And we are the only current accredited medically tailored meal program offered in the state of Wisconsin.
We are so proud to be able to partner with the Food for Health program and give our members with chronic diseases free, healthy meals. Our members clearly improved their health. The results were incredible. Our members lost a significant amount of weight. Our members improved their A1C scores, and they lowered their blood pressure. You know, eating the right types of food, the right amount of food, there's no doubt that it can contribute to lowering healthcare costs.
Surprised that by me changing my eating habits and what I ate could enhance my life, and it has.
I had someone to talk to, share my progress in eating and health and exercise. And so it was a total support system.
So an investment in Food for Health is really, to me, an investment in our society.
When people are sick, they actually impact everyone else. Our cost of healthcare goes up, access to resources go up. So when we create wellness as a community, everybody benefits. This has been a blessing. It has changed my life.
Join us. Join us in the movement. We each have responsibility and the ability to put the power of our health back into our hands and truly positively changing the lives of 50,000 individuals over the course of the next 5 years.
So thank you for indulging me and watching that video, but I thought it did a really good job of saying that Food for Health is a nonprofit social enterprise really looking to disrupt our healthcare system in its most traditional sense. We spend trillions of dollars on healthcare, but it's more like sick care because it's not moving the needle. Food for Health is focused on managing, preventing, and reversing diet-related disease through our medically tailored meal program. Right now, we're focused on diabetes, hypertension, cardiovascular disease, and now high-risk pregnancy. And so we'll get to that in just a second. And I know we're on a time crunch, Melissa, so I'm gonna look for you to do this for me to start moving into the question portion of this. So why does Food for Health do this? Well, you heard in the video that we didn't just arrive. We are the genesis of the Doman Company, which was the first apothecary here in Milwaukee on Water Street, where we were up until 2 years ago. We were first to market in wholesaling, distribution, manufacturing, and we were focused on this with a core focus of treatment. But in the 80s and 90s, with the rise of opioids, we were asked to store more and more drugs, which is highly regulated and highly secured. And what we realized is that more and more people were getting addicted to the drugs that we were being asked to store. We weren't creating it, but we were asked to store it as one of our business lines. And we wanted to get back to the root. And what we found is that food is our true medicine. And so the reason why we do this is that chronic disease has caused a health crisis where 60% of Americans have at least one chronic disease. They're draining society and killing our families, with 85% of US healthcare expenditures being spent on chronic disease. And it's hurting the ones with lowest incomes. When you think about it, 74% of those with lower income have a less likely chance of actually accessing fresh fruits and vegetables. So we have two business lines. One is which makes us a social enterprise. One is our social program, our nonprofit program, really focused on managing, preventing, and reversing diet-related disease for low-income individuals. And then our other side is more of our employer benefit, which creates cultures of health and wellness within the workforce setting. And the reason why we do that is that even in the workforce, as we're positioning ourselves to truly compete in a global society, our communities are getting sicker and sicker, where 87% of employers believe the cost of providing health benefits will become unsustainable in the next 5 to 10 years. When you look at the ledger, the profit and loss, when you look at the line item that covers benefits, most organizations saw a 20% increase. It's burdening employees, where 75% of workers report facing health challenges outside of work. If you're not healthy and you don't work, you're not garnering a livable income. And so the reason why we're focused on this, not just in Milwaukee, where we're headquartered at 2007 North Dr. Martin Luther King Drive, but it's because in the state of Wisconsin, we have an even bigger issue. So right here in our backyard, preventable disease causes 35% of deaths in Wisconsin annually, and is the leading cause of death in the state. When you think about homicide, when you think about domestic violence, when you think about the opioid epidemic, the thought that the foods that we eat are killing us the most is really dismal. And it's costing us. When you think about 65% of Wisconsinites either have diabetes, are pre-diabetic, or yet to be diagnosed. If you think it's not touching you, it's touching your pocketbooks, because all of us around this table or around the Zoom room who collect a check, our taxes pay for safety net programs such as Badger Care. And here in Milwaukee, and here in Wisconsin, we spend $1.15 on average billion annually, specifically on diet-related disease. And when we think about lower income populations, they're 9 times more likely to experience nutrition insecurity due to zip code, and they're much more likely to develop some type of diet-related chronic illness. And they'll end up in the doctor's office or in the emergency room collecting medical bills that they couldn't afford in the first place. So that's why Food for Health is really focused on disrupting diet-related disease among our most vulnerable. And so Food for Health is a part of a growing network made up of food as medicine providers through the National Food as Medicine Coalition that creates dietary guidelines and really a script of what it means to be a medically tailored meal provider, which means our registered dietitian nutritionists and our culinary team come together to create specific diet plans and meals for persons living with diabetes, hypertension, cardiovascular disease, weight management, renal disease, and also for expectant mothers who are deemed high risk. We also have a program to help manage preeclampsia, gestational diabetes, and proper weight management during pregnancy. And so through our affiliation with the National Food as Medicine Coalition, we're also affiliated with the Harvard Center for Health Law and Policy, who have done a number of peer-reviewed studies. The Food as Medicine, Tufts University just recently came out with a longitudinal study that said, looking at the overall spend in healthcare, that by adopting a model as prescribed from the Food as Medicine Coalition, that by 2030, we can reduce our healthcare spend by 70%, specifically in the chronic illness space. And so below is just evidence of what our partners at the National Food as Medicine, the Harvard Center for Health Law and Policy were able to demonstrate after reviewing 200 peer-reviewed studies based on the work of FEMIC agencies, and there's nearly 50 of us across the country. What they saw is that medically tailored meals have been able to demonstrate better health outcomes, lower cost of care, improved patient satisfaction, net healthcare cost savings, reduction in hospitalizations, more likely to be discharged to home, and an increase in adherence. Now, I also want to mention is many of you have probably heard or participated in the White House Conference on Hunger, Nutrition, and Health. I think it was about 2 years ago now. We were featured as a new and upcoming Food as Medicine Coalition member, and for our great work that's happening here in Milwaukee. And so what do we do? What do we actually offer? Well, right here in the Halyard Park neighborhood on Bell Phillips and Brown, we have a 15,000 square foot food production facility where we have the capacity to make fresh, never frozen, 55,000 medically tailored meals per week. And we have the distribution network to distribute this across the state. But our priority is right here in our backyard in Milwaukee County. And so what do we offer? We provide 10 nutritionally tailored meals delivered to the doorstep of our program participant. We provide one-on-one coaching either by a registered dietitian nutritionist or a registered health coach. We provide a health risk assessment biometric screenings at the beginning, midpoint, and end. This serves like as a health report card for our program participant to really track their progress. And we do health and wellness education that happens either in person at our headquarters at 2007 North Dr. Martin Luther King Drive, or through our app. And all of the meals, the biometrics, the checking in on what you're eating, all goes through that technology. And so to your right is an actual picture of our meals, breakfast, lunch, and dinner, a sampling of it. We have a menu of over 500 recipes that our registered dietitian nutritionists and our culinary team have put together. Each week, every 8 weeks, the menu rotates where we get food in season, locally sourced. Participants get a chance to select from breakfast, lunch, and dinner options. Like this turkey sausage breakfast burrito, blackened salmon with cauliflower mash and marinated flank steak and rooted vegetables. As you can see, these are familiar foods that are very approachable, but they're designed to be low sodium, low sugar, low fat. And so our philosophy is that we really have a plant-forward lifestyle where the portion sizes are in check, and mainly what we offer are a lot of fresh fruits and vegetables. Our plan really focused on sourcing our produce locally. And in our production facility that used to be out of Chicago, and we moved it to Milwaukee, our priority was local hires for our workforce development program. This isn't a commercial kitchen. This is a USDA, FDA food production facility. And so very few people are actually skilled at managing, working, operating. So we have a stair-step level to have people enter our workforce development program at an entry level and work their way up. And so today, I really want to talk to you about our maternal health program. And in just a moment, Melissa, I'll pause to get some questions and some feedback. So diabetes, hypertension, cardiovascular disease, renal disease are really our flagship program that we've been doing since 2020, kicking it off with one of our partners that you saw in the video, Common Ground Healthcare Cooperative. Since then, we've really been expanding because what we've learned and what we know is that nutrition plays a vital part in maternal health outcomes. And with this being a true issue here in Wisconsin, we really turned our attention to focus on the disease that I just mentioned, but also healthy birth outcomes, as that was one of the programs that Doman and the Doman Company Foundation have invested in for over a century. And so to qualify for our program, we usually work with providers, insurers, FQHCs, community-based organizations, where we set what the disease state is that we would like to focus on. And it's typical, the qualifications is that you have to be 18 and older. We do not currently serve children. You have to meet geographic requirements set by partner. So let's say if we're working with a local partner and they only want to focus on the city of Milwaukee geography, that's specifically what this partnership would focus on. We meet income guidelines. For us, we focus on low-income population specifically for our social program, and how we define that is up to 200% of the federal poverty limit, unless our partner defines low income or at risk or high need in another way that's compelling, and have consistent address with access to, like if you live in a shelter and you'll be there for at least 6 months, you could qualify. You have to have a refrigerator, access to a microwave or oven, and a cell phone. And at risk is either having a pre-existing condition, needing to manage weight due to your age or income, socioeconomic status. So for our maternal health program, how it works is that it's an 8-month program where this first 6 months is the prenatal process, to where we kick off the program with agreed upon terms with our partner, which is a healthcare organization likely, or community-based organization. We then will have our healthcare partner refer their patients to us, and we will then follow up directly with that patient. At that follow-up meeting, we then schedule an orientation. At that orientation, what happens is that we share with the program participant our food philosophy, our health risk assessment. We do biometrics, and we also have a welcome gift for our program participants, which is usually a scale, blood pressure cuff, and our expectant mothers. We have children's books for them. And in this, what's important to note here is the reason why we do the SDOH screenings and the risk assessments is that we want to understand if there are any other barriers in the way of our program participant being successful so that we can refer them out to accountable partners within the community that can address some of those social needs so that program participant can participate fully in our program. After doing that orientation, that person ends the conversation by scheduling their first meals. And like I said, out of 20 options, they get to choose 10 options of what they want that week, which is a big deal because they get choice. That's delivered to their doorstep in these reusable bags. So each program participant has 5 dedicated bags assigned to them. So as they get their food, they remove their food. When their order is coming the next week, they just put their bag out, we take it, we sanitize it. That's how we're reducing our carbon footprint with a lot of our materials. And education and practice in person or via the app is offered. So at our facility, we have Be Fuel, Be Fit, and Be Focused. That's our cooking, fitness, and lifestyle classes that expectant mothers can either attend in person or they can participate via our app. We do have one-on-one weekly coaching. Most of the coaching calls go beyond nutrition and meeting their health guidelines. And it's really triaging, where am I going to live in the next 15 to 20 days? How can I access food? I'm not, my WIC hasn't kicked in yet. Where can I go to receive local food outside of your program? Because our program, providing 10 meals, provides about 50% of the nutritional value for the specific participant in our program. Most of our maternal health program participants enter our program at the beginning of their second trimester, which means that they're in our program for about 6 months if they go full term. And then we are with them for 2 months providing nutrition in our entire program, about 2 months postpartum. And really what our goal is to really transition that mother with a feeling and experience of being fully supported and new knowledge on how to eat, not only for themselves, but for their baby as well. Some of our desired outcomes is that the mother go full term, preeclampsia and gestational diabetes avoidance, healthy birth weight, pre-postnatal care adherence, reduction in emergency department visits and inpatient stays, postpartum stress management, and breastfeeding. And so, Melissa, this is the part that I really wanted your help with. And so where I'd like this audience to lean in is that there's really 3 questions, and we have kind of like a board that we're going to put up in a minute. But the questions that we want to focus on is that we're currently doing a pilot and have a couple more pilots slated to really look at the effects that medically tailored meals has on expectant mothers and healthy birth outcomes, resulting in the results that I just described. And so 3 questions I'd like you to respond to is Food for Health hasn't gotten as many mothers enrolled into their program as expected. Out of 40 referrals made by their healthcare partner, only 25 enrolled in our program. Why do you think this is? From a practitioner's perspective, you work with expectant mothers all the time. You know some of the stressors that they're experiencing. We're looking for insight from our practitioners, our community, on how else can we be approaching this? What else can we think of? Because our priority is being sure that we're fully serving our program participants. And trust, we're also asking the ones who have accepted the same questions. The second question is, how should Food for Health address the need to service dependence of pregnant women persons in their program? So like I mentioned, that Food for Health, we have our medically tailored intervention for the adult. The feedback that we're getting is that there's a desire that we not only service the dependents in the home. So if I'm an expectant mother and I have children, that my children are also furnished with food, but also caregivers. And the last question is, Food for Health's program is 8 months, and pregnant people usually enroll at the start of their second trimester. Should Food for Health offer a step down or graduation for the maternal health participants? If so, who should be included? And so this question is that we currently offer a step down for our 6 and 12-month program. And so my question is, what should that look like here? And so I know I've taken up a bit of time. Melissa, I'll stop sharing if we want to pull up that other screen.
I've been putting the instructions into the chat, so I provided the link to a Jamboard. If you're familiar with that program, it is on the Google platform. I know some folks' work platforms are not friendly with Google, so you can also type your feedback into the chat. But if you use the little left and right arrows at the top of the screen on the website, it'll take you through the same questions that Raina just had on the slide before this one. There are different colored sticky notes on each one with a couple, on the referrals page, and then the family participants and the graduation/completion stage. That's what you'll find if you go to the left and the right. And so if you double click on those sticky notes, you'll be able to type. If you need more space, you can just kind of, number them 1, 2, 3 or whatever and kind of group them together. It's okay if you overlap those sticky notes. I'll move them around and I'll pull all the feedback out. If you need to add more, you'll have a toolbar on the left there. So please, you can also, again, put it in the chat. Raina, there was a question in the chat about which healthcare system is providing the referrals. I wasn't sure if you wanted to.
I'd rather not state that at this time. Mhm. Yes.
And so they are, I believe this is still at the early stage, right, Raina?
Yes, so I'll say that we are slated to, so we've launched a 120 person pilot. And with that, right now we have over 25 pregnant women enrolled, and it's in a staggered cohort model. And in this cohort, the mothers in the program absolutely love it, and they're forming a network and a community among one another. And so there are opportunities for them to fellowship at our cooking, fitness, and lifestyle classes. And some of the feedback that we're getting is that they would like snack packs, as an addition to the foods that we're providing. They would also like some snacks or nutrition provided actually at the clinic. What I didn't mention is that we are providing transportation passes for them to get to their doctor's visits and to the welcome visits at Food for Health. Mostly everything else that is done is via the app or via phone. So the coaching calls happen weekly, and they're 15 to 30 minutes, and they're really wellness check-ins and to set goals towards their health outcomes.
I just want to remind folks, double click with your mouse on the squares to type. You don't have to drag and drop, although if you want to move them, you can. So just click twice on it. It should pop up bigger and you should be able to start typing. I know Jamboard is a little tricky sometimes for folks. This will stay open. So if you need some time to make it work, you'll be able to do that. Just to confirm, for covering the cost of this program, it's philanthropy supported, right? You're muted, Raina, if you were talking.
Yes, our program participants pay nothing for this program. And especially with the most vulnerable, there's no way that they would be able to afford this program. And so to really disrupt diet-related disease and in the current social norms, this program is really designed to introduce them to new foods, help them exercise preparing that food, and work with them to identify sources in their local community so that they can sustain it. Being a nonprofit organization, our focus is really to help transition our program participants to a place of self-reliance. And once they graduate from our program, many of them then become volunteers to support and coach other participants through our program. And it's not a coach as in the formal setting that they now become nutrition coaches. It's not that, but more so peer advocates.
So they are at a point where they could maybe do some pivoting early on to make it more accessible, plan for that offboarding, whatever it might be. Please remember to click those left and right to go through the different slides. Again, this is going to stay open so you can think about it. You can provide the feedback later. I'll keep it open for probably a week or so, but I do want to get us moving forward. Raina, if you're interested, you're welcome to put your contact information in the chat if anyone wants to get in touch with you about learning more. I got to tour the facility. It is very cool. And so we are going to move forward into our prioritization activity. And you know, we're gonna be maybe a little more truncated than expected, but you know, I think we'll be able to get it done. Thank you, Robert. Go ahead forward. That was just my attempt at summarizing what Food for Health does, but it's difficult to summarize everything they do. So just for some background, we are trying to find some strategies to start prioritizing. And in the meeting we had in November, the last meeting of 2023 for this group, we split up into breakout rooms, focused on our 3 goal areas, and we started the conversation around what to do in 2024. I attached to the calendar invite, that was the update I sent just a little bit before this meeting. I attached a couple documents with some summaries to that. And so today we are going to finish that conversation and identify what we're going to do this year. Go ahead to the next one. So our main goal is to identify 1 strategy per goal area. So healthy birth outcomes, reproductive healthcare quality and access, and maternal family mental health. Our big criteria, something that is achievable by the end of 2024, and I'm gonna need, you know, 2 to 4 people willing to raise their hand and say, yes, I will be part of the team taking on this strategy. Those are the 2 big ones that we need in order to say, yes, this is the strategy we're gonna do. Additional topics of conversation, we can start to, you know, bring things like an equity impact or impact on the city of Milwaukee, what success might look like, and also kind of, is there a way we can get a smarty formulated metric along with the activity? But really those 2 big ones are 2024, we need folks to say, I'll do it. I did draft some suggestions, so I looked at the November conversation and kind of put some of them into some just suggested strategies, but those are just a starting point. If you want to go with one of those, you are welcome to. If you say, I've got something totally different, you know, make your case, go for it. I just wanted to kind of formulate some things into actionable strategies. If you want to go to the next one. So we are going to do 3 breakout rooms. You're going to self-select. Go ahead and put yourself in the room that your work most likely aligns with, or one that you're particularly passionate about. So again, that's going to be healthy birth outcomes, reproductive healthcare access and quality, and mental health. There will be a facilitator in there to help guide the discussion and, you know, keep it moving forward. There's also an area for the, you know, a parking lot of sorts. If you have something in your group that you're really, really interested in, but you just can't think, you know, it's not feasible for 2024, or it needs more work or something like that, you put that in the parking lot and then we can revisit it for exploration in 2025. And then we will plan to do a really brief report out at the end of the activity, just for each group to say, here's what we identified. So if you want to go to the next one, that's the report out. That's all right. These are going to be our groups. I will set up those breakout rooms. It's asking me to recreate, but I do not want to recreate our rooms from this morning. So,
Melissa, I got it. I'll do this.
Thank you. I didn't expect it to lock me into the settings I had at the start of the meeting. So healthy birth outcomes, reproductive health care, mental health. Amanda, as you're prepping those.
Can you repeat the second one?
Reproductive health care.
Forgive my spelling if anything's messed. So you should see on the bottom, there should be like a pop-up where you can choose the breakout room. And then you should be able to select which one to go to. But if anyone is having trouble with that, let me know and I will help move folks around based on where you want to go.
So if you get to a room and there's no facilitator yet, we're just making sure everyone gets into those rooms okay.
When you say you can see at the bottom where? What are you talking about?
So there should be, Melissa, you're better at describing this.
Did a box pop up for you, Dr. Greer, that says breakout rooms?
No.
No, and it looks like maybe a couple folks didn't get that.
Then don't worry about that. Let me know, Dr. Greer, which room do you want to go to?
Healthy birth outcomes.
Okay. And then Carrie, I saw you, 2. You want to go to the second group? Got it.
So again, folks, if you had that pop-up box, scroll down past the list of participants, and you should see those 3 lines. Maybe you're starting to see names under those categories. There's a little blue button that says join. Make sure you're finding the one with the topic you are most interested in. Healthy birth outcomes, reproductive healthcare access and quality, or maternal mental health.
And feel free to just get off mute and let me know where you want me to send you.
And then Melissa, did you need me as a facilitator or did you want me to watch this space? So if people get kicked out.
That's probably a good idea to have someone stay here just to make sure they can be redirected.
Okay.
Yeah, and Alex, can you take over? I'm gonna jump into my room now.
Yep.
Same. think it might have given the 1 minute warning to everyone else, and we're the only ones that got pulled out immediately.
But while we're here, I think, something maybe to throw on there is like, what would accountability on that training look like? Because I think that can get at, what are some real big inhibitors to, systemic change within some of these larger organizations and systems.
Yeah, sounds great. Thanks.
I do know, I did get in with, sorry, yeah, I do agree, Benjamin. But another note, I think that I did connect with St. Mary's Hospital, and they have a huge, maternal ward specifically for perinatal mental health. So I can reconnect with them to see what their process and procedure is, because I did train them at a point and they were kind of like, we already know all of this. And I was like, oh, okay, sorry. But
Great. So that's where our
um,
scan comes in.
yeah, so I can talk to St. Mary's Hospital for sure. And then I know that 16th Street Clinic does screenings as well, because I tried to collect data from them before on it. So that's something that I feel like would be a good,
Some starting points.
yes. So St. Mary's and then 16th Street.
Children's through the Ibuki Center as well.
Where?
Children's Wisconsin with the
Oh,
Ibuki Center, I believe, has implemented screenings.
okay. Do you have a connection there by any chance?
I could try and find one.
Okay, thank you.
I can always make connections if you guys need to contact each other after this meeting. So hopefully folks keep coming back. We're probably gonna end up going over. Sorry about that, everyone. Might just close those rooms now. 5 seconds, they will be back. All right. Here we go. Looks like everyone is back. I will kick off our report out for the mental health group. We realized that we might not be ready to promote universal screening, so we are going to start in square one, do an assessment of the current landscape of mental health screening among the healthcare systems, so we can see where everyone's at, what their follow-up protocols are. Let's go to healthy birth outcomes. What did you identify as your goal or your strategy?
Well, we had a lot of great ideas and discussions. So the top 3 items, one is we need a clearinghouse or registry of all the resources available so we can do a better job tapping into each other's availabilities. Another issue is funding at the state level and working with the state and DHS, not only looking at Medicaid expansion, but there are other resources and getting ourselves better organized so we can be very powerful and successful in writing grants. We spoke a lot about doulas and how we also need to be better connected. We also had a focus on what I would call community collaboration around food, healthy food, but also the dads and supports program. And these are 3 big areas that seem to bubble up. We did not select a priority and we did not identify leaders yet.
Got it. I know that's the big one. That's the biggest bucket. So it is a little tough there. Reproductive health care.
Yeah, so we came to kind of an agreement to focus in on our first goal around increasing universal syphilis and STI screening for all pregnant people. And we're going to start with really collecting the data and the evidence. So some of the team at MHD are already working on putting together a congenital syphilis brief. And so we're going to keep everyone updated on the progress of that. And then Allison and Sumaya are going to connect around getting more data and evidence to support this initiative. And then also focus on bringing some more insurance payers into the conversation to explore opportunities there. And then anyone else from my group want to add anything that I missed? All right. Thanks everyone for a great conversation.
That is great.
The only thing that I would add is we did also talk about like the opportunity to partner with some of the other private healthcare systems who already have health equity goals and advocating to them that they include some of the screening for syphilis and other diseases in their health equity goals, right? So that may be like a pathway to be able to share that data to get them to take action while we're still, you know, looking at other funding or the connections with some of the payers.
Awesome. That is great. I'll get notes from all these groups and I'll start figuring out how to do follow-up on all of this. I realize we're already over time. We all know that I can do the wrap-up super quick, so bear with me as much as you can. Robert, bring us back to those slides. Speed running this, guys. We got it. Go ahead to the next one. I do have one more thing to bring up. The Black Birth Symposium. I know that there is cross-goal interest in this. A lot of us, all of us, I'd assume, are interested in seeing this event continue. Is there any interest or willingness to create a dedicated subcommittee / work group for the Black Birth Symposium, separate from the other goals that we were just discussing? Or maybe instead of something like that, feel free to use the handout. I think Benjamin put something in the chat.
This is Teresina. I have a question. Is the previous group that was meeting for the birth symposium, are they still, I mean, I used to be a part of that as well. I just haven't heard anything. So I don't know if that, you know, if the other group outside of here was continuing or if this is kind of like a rebirth of that group.
I think that might be kind of part of it. Benjamin, you seem to have the date. I think you know more than I do, because I haven't even heard that. So it looks like support is needed. So maybe we can just be a support. It sounds like it is. There are people working on it, but maybe they need more. Are there any folks?
I've talked to Maureen Post, who said that they will be calling the planning committees back together. They were supposed to, you know, work on getting the place, and they got the date and the place at the Pfister Hotel. The 11th being the regular conference, and the 10th being for the community with resources and vendors and you know, gathering for community. But that the 11th would be the one, the regular one. But I did reach out to her, and she said they definitely would be pulling the committees back together, and that she would be letting us know.
Okay. So Dr. Greer, if you want to stay in touch with me, if they have any, you know, if they need to reach out to this network here, I am happy to do that. To send the word out as more information is known, and that way maybe they'll have a more specific ask. You'll be able to judge for yourselves if you have the capacity to help with that. But in general, if you're interested at all, I can put your, you know, generate an interest list here of folks. So that way, you know, we're ready once they do put out that ask. So put it in the chat, or you can email me directly about it. Take us to the next one, Robert. Thank you so much. Let's go ahead to the next one. Just a quick summary. In December, we launched the full CHIP report. It was very exciting, a really successful event. We had over 80 attendees, and we had multiple news stories from WPR, Telemundo, CBS. It was very exciting. On the right here, I won't go through all the specifics, but we did have boards up for some storytelling, so folks could go around the room and kind of put sticky notes up with their stories around each of our big main categories. And we got some nice feedback, a lot of networking time. So the next general meeting will be in June, and we love those times for all of us to come together across groups. Go ahead to the next one, Robert. We do have a quick ask from Marlene, our perinatal mental health person. So the health department is hosting live webinars on our Facebook page, and they want to have one about the common complications that can happen during a birthing experience. Many moms have, ideas and expectations around what their experience is going to be, and it can very easily get shattered during the actual birth experience, and that can pretty easily lead to some PTSD. And so their ask is they are looking for a clinician, a midwife, an OBGYN, a doula, someone in that birth working space to be a guest speaker on one of these events. It can be pre-recorded or done live. That's up to you. So if you are someone or if you know someone who would be interested in kind of talking to a Facebook population about these birth experience expectations, that event is going to be on April 23rd at noon. Marlene's information is at the bottom there. And if you need more information, just reach out. This is just our usual ask for implementation partners. If you are considering it, but you're unsure, just reach out to me. It's just that way to kind of make it official, your commitment to this process. Go ahead to the next one. The next meeting of this group is going to be in May. We are planning for a hybrid. If it's nice weather, maybe we'll see about all in person, but I know I like to offer the accessibility of, both options there. And this is just kind of some suggestions for, future activities. We could do training or education sessions. We could do strategy implementation updates as we have these groups identified. And if you have other ideas for future meetings, please let me know. Go ahead to the next one. I have a lot of email opportunities, so watch your inbox because there are trainings, there are educational things. Lots of people have sent me some great stuff, so keep an eye on that. And this should be the end. Robert, there it is. This is me and my fellow co-chairs information. If you need to reach out about anything at all, I can stay on for a couple minutes. I realize I've kept you for 10 minutes over. Thank you so much, everyone, for joining this meeting, for sticking it out, and for participating. I really appreciate all of you.
Melissa, did you see my question in the chat?
Oh, I don't think I did.
Okay, I'm going to send you an email. I have a question about, I'll send you an email.
Sounds good. And if you want to schedule another meeting or anything, just let me know.
Great. Thank you.
Thanks.
Thanks, everyone.
Thank you.
Take care.
Thank you. Take care.
If anyone took notes, please remember to send them my way.
Oh, okay. I took a little.
Oh, sorry. That was more for my co-host, Dr.
Oh, okay.
You're welcome. If you think you are welcome to share your notes, but I was just trying to catch my co-host before they signed off. I'll leave it to you.
Yeah, I probably need a night to kind of organize it all, but I'll get them out to you.
Sounds good.
All right. Thank you so much.
Thanks, everyone.
Bye-bye.